Ziering. I'm one of the RNs here at the American Medical Group, and I'm here with Dr. Shabaz Farnad, and he's going to talk to us a little bit today about postpartum pain. I've had 2 kids of myself and have definitely experienced it, so I'm really interested in hearing all about postpartum pain and what you can do about it. So can you first just tell us a little bit about yourself and how you got interested in postpartum pain?
Sure. So I'm Dr. Shahbaz Farnad. I'm the medical director at American Medical Group. I'm an anesthesiologist and pain management specialist. So I see a lot of women, in particular with postpartum back pain, neck pain, all sorts of things, and I specialize in pain management. So that's kind of the background. I also currently do OB and labor anesthesia at Long Beach Memorial Hospital. I've been doing that for the past 3 years.
Can you tell us about this practice here, though, itself, like what we're all doing here?
Yeah, so we have a multi-specialty practice here. It's a center of excellence for head, neck, and spine specialties. We have medical, dental, and surgical subspecialists, everything from aesthetics to facial plastic surgery to ENT, hearing restoration, and I do pain management, and we have orthopedic spine surgeons as well. So for all of your head and neck surgical and medical needs.
Yeah, when I found out he was working in postpartum, I was in labor and delivery, I had a lot of questions about postpartum pain, and I wanted to know what was normal, because I feel like as women, we don't always know exactly what is normal and what pain level should be tolerated and what you just live with. So Can you explain a little bit what is normal postpartum pain?
Sure. So with pregnancy, a woman's body goes through a lot of changes, and some of those changes are visible and a lot of those changes are not. So in the immediate period after delivery, a lot of women start to experience things that they've never experienced before, and a lot of that is pain related. And some of it is normal and some of it is not normal. You know, with everything that goes on in the immediate period after delivery, women, especially first-time mothers, don't know what to expect, and they don't know what's normal and what's not. So this is kind of for us to allow people to kind of learn a little bit more about what they should expect and when they should actually seek professional help.
Yeah, I think you never know what exactly is normal and what you're supposed to deal with. So what are the different types of postpartum pain that you can have?
Sure. So pain is typically categorized into 2 categories. We have acute pain, and then we have chronic pain. So acute pain is what we would expect in the immediate period after delivery. So, and with postpartum pain, it could be classified anything that happens in the first month up to the first 3 months. And you know, a lot of that is abdominal pain and cramping. You could have some pelvic pain. You could have chronic back pain, acute back pain, and some shoulder pain and scapular pain. So those are typically the acute pains that are, for the most part, normal.
Yeah.
Then you get into patients that have chronic pain after delivery, things that happen but they never get better and they may even get worse. So that also falls into that abdominal, back, and shoulder and scapular pain, but there may be some warning signs that would show the woman that she would need to go see a professional to rule out anything more dangerous.
I've had a lot of friends that had epidurals and had a lot of pain after epidurals. Is that normal, and when should you talk to somebody about this?
Sure. So a lot of women are concerned about whether or not they should get an epidural, what the risks are, and after the delivery, anyone that has back pain, they may think that, oh, was this because of the epidural or not? For the large majority of patients, the back pain that they experience postpartum is not related to the epidural. The only time that we're really concerned about epidurals causing pain that would last after the initial first few days, or if the woman had a very traumatic sort of epidural placement. It took the anesthesiologist a particularly long time to put the epidural in, or if the anesthesiologist warned the mother that she may be having a more severe kind of outcome than others because of a complication that they experienced during epidural placement. For the most part, though, the back pain that women have after delivery is unrelated to the epidural. For 99% of patients, the reason that they have back pain is because during labor, the ligaments that support the spine and the core sort of loosen up, and that stretching of that is a result of the pushing and the labor, the prolonged labor, is back pain as a result of those ligaments opening up.
But how can you prepare yourself to be okay during that process, because it's such an extreme process our bodies go through. So what do you recommend as a pain specialist for women to do to not have these complications?
Sure. So, women come to us after the fact, right? A lot of patients come to us when they've already kind of gotten to the point of like severe pain, they've gone to multiple doctors and they haven't been able to be diagnosed. The best thing for postpartum pain preparation is preparation, right? And a lot of that has to do with core strengthening. So as a result of the changes that a woman's body goes through during the labor, particularly with the pregnancy, with the abdomen kind of expanding the muscles, expanding the ligaments, opening up the pelvic floor, opening up the back muscles, sort of relaxing. Those types of changes all lend themselves to patients suffering chronic pain afterwards. So what we want to do is during the pregnancy to prepare the women by having them exercise, doing core strengthening, whatever they can to sort of strengthen their core so that when the muscles are wanting to go back, when the uterus starts to shrink again after delivery, when those back muscles start to go back to their normal size and shape, that the core muscles and the core is strong enough to be able to stand the strain of labor. And that's the most important thing. So during the 9 months of pregnancy, it's very important for women to practice good sleep hygiene, to be hydrated, to support the muscles, to have good exercise routine, to have good rest periods between periods of extreme work and kind of, if you're taking care of another baby already or got another kid at home, you want to be able to kind of pace yourself as well as support your body with good diet, good hydration, good exercise to be able to withstand the pain that's coming after the delivery.
Oh, for sure. One of the things I had the most problems with after having children was breast pain and back pain related to that. So can you speak a little bit about that? Because I know every woman goes through huge changes in their body after having a baby, and that is a huge topic for many women is breast pain.
So for first-time mothers in particular, I think a lot of women are surprised at how much the breast can grow during the pregnancy and after labor. So the biggest thing is that big breasts can get heavy and your body frame may not be able to support that extra weight and you're not used to it. So your posture starts to kind of go in a bad direction and you start to kind of like just go through the path of least resistance and you start to have poor posture and that extra weight of the breast getting larger kind of puts a lot of stress on your scapula and your shoulder region. And if you're not prepared for that or you don't know what to anticipate, that could cause a lot of back pain. Again, with breast pain also you can have pain that's due to the breastfeeding. So you want to make sure that the nipple area is clean, that you do warm compresses, that you keep the nipples moisturized, and you have a sort of routine that you prefer that keeps the nipples from drying out and causing thrush in the nipple area and the areola. So keeping it clean after breastfeeding is very important. Keeping your baby's mouth clean as well, that's partly something to consider. But with the increasing breast size of the breast, you want to have good support. You want to wear a bra, a good supportive bra, as often as possible.
So not the Victoria's Secret with the wires and the lace. You gotta get the good stuff.
You want get a good cotton bra with good support. Maybe go to a maternity store that does the fittings for you and teaches you the exact correct way to wear the bra. And I see women all the time with scapular pain in particular because they're wearing an improperly fitted bra and they don't know how to wear the bra properly.
A lot of these maternity shops, they will actually, when you're pregnant, kind of measure your breast right before you have the baby and can predict close to what size you're going to be after you have the baby. So if you can't come right back in, you'll have some bras to prepare you. So make sure you talk to your local maternity shop and see if they're educated on that.
Yeah, and you want to also make sure that it's not just your cup size that you're concerned about, it's the support that you're getting from the shoulders and the scapular region, and that you're wearing the straps correctly, and that you have a little bit of leeway with the breast kind of increasing or decreasing in size as you get through the postpartum period.
Like with posture, because you're holding a baby, you're looking down, you're obsessed with this new little creature and you can't stop, you're always like this. Do you recommend anything to keep that posture to remind you, I need to straighten up?
Yeah, so posture is crucial because exactly like you said, you're holding this baby all the time, you're hunched over, and you're not used to doing this, or you're walking with a baby and kind of getting really bad sleep. Maybe you're not getting a regular sleep. You're not hydrated. So all those things play kind of like little factors that can kind of play into the whole pathology of it. With posture, the most important thing is habits, right? So you just have to constantly remind yourself to sit up straight, not to hunch over, to hold the baby properly. And that is something that kind of we want to reinforce. There's that little device that you could put in the back of your neck that kind of buzzes you to remind you. I love that. I think that's great because it reminds you to sit up straight. And I would recommend that to my postpartum patients for sure.
A lot of people.
Help them. Yeah,
it's a great one. So we have talked about that. You're saying there's the different types, and there's the normal, and there's the acute. But what do you do about the chronic pain? At what point do you consider it chronic? When should you be seen, and who do you see?
So anything that's after 4 to 6 weeks after the delivery, I would be concerned about. Of course, there are the cases where the mother is not able to get good sleep, has had poor posture and things like that we could rule out in the visit. But any kind of chronic pain that's lasting over 4 to 6 weeks after delivery, I would want the mother to come and see a specialist. And I would recommend going to a pain management specialist, an MD or a DO. A physical therapist would be a good first line treatment. Your gynecologist or your obstetrician is a good source. But you need to go to see a specialist to rule out all the potentially dangerous situations, a nerve entrapment or some other pathology that may be going on that you don't want to put off diagnosis 3, 4, 6 months. So if you're having pain 4 to 6 weeks after delivery, I would recommend you visit a specialist just to be sure that it's nothing more serious. And the symptoms that we would look for are any kind of like numbness or tingling, any sharp shooting, stabbing pains, anything that's affecting the way that you may walk, keeping you up at night, those types of things. And a lot of times these diagnoses, 99% of the time, are benign. You just come see the doctor, they tell you what to do to improve it. They give you maybe a prescription for some medication that could help, those types of things. But we want to be able to diagnose the danger areas and the problem patients early on so that if there is some sort of nerve damage or if there is some sort of pathology that we need to work up, we catch it early on.
I love this because I feel like so many women have been just told you just deal and you get through it and it'll eventually go away, but it's so nice to know that it's not necessarily normal and there is something you can do about it and there are people you can see to help treat this. Thank you so much. Is there anything else we need to touch on today?
I just wish all the mothers the best. I know it's a really tough time right now being pregnant and expecting during coronavirus, so hang in there everybody. Everything is going to be okay. I hope everyone is safe. Practice good hand hygiene, do all the things that everyone is saying, social distancing, but I know it's an anxious time for expecting mothers, and if there's anything we can do to support you, please reach out to our offices. We'll be happy to help.
So how can everyone find us here? Can you tell them?
Yeah, so if you're in LA, we're in Miracle Mile, just in the mid-Wilshire district. We're in the Screen Actors Guild building on the ground floor. Our phone number is 323-433-7744. Again, that's 323-433-7744. And you could check us out on our website, miraclemilemedicalgroup.com. And
Instagram.
Yeah, and on Instagram too.
All right, thank you so much for being here with me today. This was great. We'll see you guys soon.